Madam Speaker, we continue as a caring government to target the most vulnerable in our society. A few budgets ago, we introduced a facility where hundreds of seniors, not qualified for contributory pensions, but who have worked hard to help build Dominica, would receive a monthly stipend from the government. The response to this initiative has been overwhelming. I firmly believe, Madam Speaker, that just as corporate Dominica will directly benefit in this budget from the growth of the Citizenship by Investment Programme, so too must the needy and more vulnerable in our midst. Madam Speaker, all available studies suggest that it is the elderly, as well as infants, who are our most vulnerable. In this budget, we shall address their concerns. It is debatable what is the true cost of a basket of essential items for a senior over the course of 1 month. In the context of Dominica, much depends on where you live and who are your neighbors. What we do know for sure, however, is that the current minimum pension payments are simply not enough to afford a significant number of seniors a satisfactory quality of life and standard of living. In this context, there are two categories of pensioners: a contributory and a non-contributory pensioner, meaning those who have made adequate contributions to qualify under the Social Security Program and those who did not contribute. As I referenced earlier, we moved a few budgets ago to address the interests of those who did not contribute adequately. What concerns me, Madam Speaker, is that we have a duty as a nation to provide for our seniors and to ensure that they live healthy and dignified lives in the twilight of the year. In 2014, we mandated that they receive $200 a month. This has helped, but in my opinion, it is not enough. The Citizenship by Investment Programme has been of enormous assistance to Dominica in helping to boost revenues, and government feels strongly that its most vulnerable citizens should benefit directly from this program. Therefore, Madam Speaker, I am pleased to announce a 50% increase in the non-contributory allowance. A 50% increase in the non-contributory allowance, social allowance for persons 70 years and older, from $200 a month to $300 a month. Effective 1st September 2016. Now, Madam Speaker, I know this will raise the question of what about those who have contributed? That is a fair and reasonable question, deserving of a forthright answer. They too live in Dominica, and they too are deserving of the guarantee of a satisfactory existence from a country to which they gave their all. The Dominica Social Security Board has done a remarkable job of managing the resources of workers in this country. I wish here to congratulate the directors, management, and staff for the fantastic job they have done and continue to do. It has been of concern to us as a government that some pensioners receive less than $55 a week for contributing to the system. Were these levels to remain in effect, it would create the anomaly whereby persons who did not contribute would, as of September 1st, be receiving more than those who did. This clearly would not be acceptable. Madam Speaker, as Minister responsible for Social Security, I propose immediately upon passage of this budget to meet with the board and directors of DSS to create a mechanism whereby the bottom tiers of Social Security pensions will be brought cumulatively to no less than the same $300 a month level as a seniors allowance paid by central government. Furthermore, I request that there be an actuarial study into what additional increment can be granted to DSS pensioners currently receiving between $300 and $500 a month. So while they will not receive the same percentage increase as those who were below 300, they too would by 1st January 2017 also receive a proportionate increase in the amounts received. To put simply, Madam Speaker, what the preceding measure will do is guarantee, for the first time in the history of Dominica, a reasonable income for every single person aged 70 and above in this country of Dominica. Not only shall we guarantee them something, but that something as of 1st September 2016 shall be a minimum of $300 a month. Madam Speaker, I said earlier that the two most vulnerable groups were seniors and infants. Many infants are born to single mothers who themselves have challenges because many fathers in our midst are not manning up to their responsibilities. The issue of delinquent fathers is one that I will address and deal with in the months ahead. So be warned. I hereby give early warning to those men who are able but who are not taking proper care of the children that their happy-go-lucky days are coming to an end very soon. My philosophy on this is simple. Pay up or go up. The maintenance bill will therefore be brought before the Parliament for consideration before the end of 2016. But that, Madam Speaker, is an issue for another time, most likely in this very same place. On this occasion, I believe as a nation, there are certain realities we must confront. Single parenting is real. We cannot wish it away. We want, however, as a government to do something for single mothers in particular. I am reliably informed, Madam Speaker, that a significant percent of income of single parents is devoted to health care for the children. These women, being of childbearing age, are also of working age. We have spoken for years in this country, Madam Speaker, about the ultimate need for a national health insurance scheme in Dominica. Like the construction of a new national hospital, this is not something that can be done overnight. It will involve considerable study and analysis. But I'm aware that especially during this post-Erika period, some single parents have been experiencing some challenges. I speak here of the women employed in the hotel and tourism sectors, in the distributive trades and small businesses. Their incomes are relatively low, and taking care of the health and other needs of a child is an added responsibility that becomes a burden when fathers are not pulling their weight. Immediately upon passage of this budget, Madam Speaker, government will discuss with the Dominica Social Security to determine how an initial installment of $5 million can be set aside and utilized in the creation and administration of a pilot health insurance scheme for these workers and their children. My contention is that we cannot just speak about these things and never attempt them. We have to start somewhere and perfect the service as we go along. My thinking is that effective 1st January 2017, mothers of children 3 years and under and all expectant mothers in Dominica will be eligible to register with the pilot health insurance scheme to have up to 80% of all medical bills associated with the care of the unborn, newborn, and infant paid by the service. Madam Speaker, there are countries in this region and elsewhere that have implemented national health insurance programs. I do not believe it is beyond our capacity to create a facility that can first serve the needs of young mothers and mothers-to-be, and ultimately the needs of all Dominicans. This shall be effected by 1st January 2017. Madam Speaker, I said this budget is about building a resilient Dominica. This undertaking cannot only relate to buildings and bridges. I am convinced that the building of a resilient Dominica must not only target the productive sectors, but it must also involve building a social safety net for our most vulnerable citizens. The Dominica Labour Party administration is determined to make government work for the people. Over the years, we have allowed entrenched bureaucracy to frustrate and oftentimes deny citizens their due. As Prime Minister, I sit and interface with thousands of Dominicans on an annual basis who have relatively simple but urgent needs that the government is in a position to address and resolve. Somehow, in all of the modernity and reforms we have pursued, we have not yet mastered the art of solving people's problems. We have to simplify the process of government to make it work easier and in a more efficient manner for citizens. The Public Support Programme administered from the Office of the Prime Minister has been remarkable in attempting to address and resolve this challenge. I am satisfied, however, that a time has come for us to create the necessary administrative structures that will allow government to be more accessible and also more receptive to the needs of our citizens. People having emergencies, whether health, domestic, or financial, should not in 2016 be bounced around from pillar to post in search of a remedy. I believe there ought to be clearly demarcated structures for channeling of such concerns. Accordingly, Madam Speaker, it is my intention in this new financial year to broaden the scope of the Public Support Programme with the establishment of a fully staffed secretariat encompassing 4 regional centers located in the north, south, east, and west of Dominica to cater to the needs of our citizens. Suitably qualified and skilled social care coordinators will be employed and deployed in these respective centers to garner all relevant information for processing by the central office, which shall remain an agency of the Office of the Prime Minister. Madam Speaker, I can already hear some in our midst complaining of the perpetuation of a welfare state and a mendicant mentality. They are entitled to their point of view and can continue to espouse it. I do not subscribe to the dictum that all men and women are equal in the sight of the retailer. If persons do not have the wherewithal to help themselves, then I believe firmly that it is the responsibility of the state to help them. We have to continue to wage a frontal war on poverty in this country, and I intend to simplify the process where the concerns of citizens can be addressed and remedied in an expedited and dignified manner. Madam Speaker, it is my intention in this financial year to channel $5 million from the Citizenship By Investment Programme and other revenues of the state for use in the expansion and decentralization of the Public Support Programme of the Office of the Prime Minister. Madam Speaker, those who take issue with ordinary citizens accessing help in this country can speak their minds in the ensuing debate and let their positions be known and known very clearly.